Hello. This is way more fun with 3 people because we're already laughing. I am Julie Hirschberg from Re+active Physical Therapy, and today I'm going to do this every time because it's so fun. And we haven't started. We have our team here, including the very amazing Maggie Yamamoto, our current doctoral student from USC. And we have the very newly neurologic clinical specialist, Chelsea Brown. Chelsea is been really passionate about and heading up our new concussion team. And Maggie's been a big part of that because it's an interest of hers, and it's something that we've done work with here at Re+active, and we're just diving in more and pretty excited about it. And so Chelsea and Maggie have really put together a really nice summary of the physical therapy role. Not everybody knows that physical therapists work with people who've had concussions and really help them get back to that full maximum potential. A lot of people who've had a concussion start to really be limited in maybe it's getting fully back to school, fully back to sports, fully back to work at a very full capacity, and that's where we come in. So we're going to do interview style a little bit, and Maggie and Chelsea on the spot. And I think a lot of PTs know about concussion, but maybe not the whole public about what we can do. So tell me why someone who is post-concussion might work with a physical therapist.
So I can take that question.
Okay.
But so a lot of times with post-concussion, you can have like prolonged symptoms, and so you want to see your local physical therapist or somebody who specializes in that so that they can get you on a program to do like back integrated activity exposure, and you can work closely with a neurologist as well, and they typically do a really good job with that and giving a lot of education regarding that. But you want to monitor how much like cognitive tasks you're involving and activity-based, especially if you're an athlete and you want to go and you're in school and you want to gradually increase those things and not just go full bore into it and not just go straight to bed with the lights off and no exposure at all. So it can be like a fine line of where you want to go with that and how to increase that. You also want to look for trigger avoidance, so abstaining from certain activities that can give you a lot of symptoms, and that can be just like different screens, high intensity exercise can give you symptoms. So you just want to find what those triggers are, and not everyone is the same. Everyone will have like different triggers. So you can work with your physical therapist closely, and even symptoms that you may not think are from a concussion that actually could be, then you want to find out those things as well. And then the physical therapy will focus on reduction of those symptoms and then reintegrating that into your daily routine and hobbies and get you back to 100% of where you want to go. And it can take a short amount of time and you can have like a full recovery right away, or it can take a long time. So that is another reason why you want to see a physical therapist right away or a neurologist, and have a team on your side so that they can monitor that and help you understand that closely.
That's awesome. It makes me excited to be a PT and help people. So what happens, this is where like the neuro nerdy part of me gets excited, but what happens in a concussion where there might be a need for physical therapy or an exam?
Yeah, so in a concussion, you get these like microstructural changes and like specifically metabolic changes in the brain that occur all throughout the brain. And so you'll get these diffuse signs and symptoms like headache, fogginess, nausea, vomiting, fatigue's a big one too. And it's because of these like really diffuse changes in the brain that occur. And it can happen from a direct blow to the head, but it also can be like an indirect force as well. So it's not always, you know, your head hitting something. And because of these widespread changes, we also see a lot of like visual and vestibular disturbances because so much of our brain is contributed to those systems. So they might come to physical therapy with these signs and symptoms, and you might have to do vestibular rehabilitation with them, helping them, do graded aerobic exercise and those types of activities to help them get back to doing what they love to do.
Yeah, that's really great. And I think this is one of the tricky parts, right? Because those small changes don't show up on imaging. Your traditional like MRI imaging, and this is what makes concussion sometimes one of those hidden things is, even on a standard neuro exam, some of those things wouldn't come up. And so getting that specialized testing, and this is where I'm so lucky to have Chelsea as part of our team and a couple of our other team members as well, but having that vestibular background and the neck pain and integrating that so you can get into understanding those symptoms more. So that's awesome. And I know there's a lot of assessments that we can do. So what are some of the special pieces that we would do to get at some of those symptoms?
Absolutely. So the most important thing that we would want to look at is just differentiating, is this something more serious and needs to be referred out? Maybe it's something more specific that is caused like more brain damage or needs direct resolution from medical staff or team. So we want to do an interview and review of all your systems, doing like a full complete neuro screen, taking a look at just different central signs that may be present versus just kind of overall symptom progression. And then we want to ask questions to understand the symptoms because, like I said before, everyone is different. And so a lot of concussion can present very differently, whether that's dizziness or headache or fatigue or balance. All of these things can be different signs and symptoms. So we also want to look at the vestibular ocular motor screening tool that we have, also called the VOMS, which is a little bit more recent, and I think it's becoming more well known, but this is a really important test to standardize across measures. And Maggie will talk a little bit more about the correlation of that with concussion evaluation. And then we want to look at like the aerobic exercise capacity, using things like the Buffalo concussion treadmill test, which I'll talk about a little bit later as well. And then looking at your autonomic nervous system. So a lot of times with post-concussion, you can have changes in heart rhythm or heart rate or blood pressure that wasn't necessarily the same as before. So looking at like your movement analysis and overall systems and making sure that we're finding little things that may come up.
Yeah, that's great. And I feel like we could do a whole episode just like on cognitive screening, for example, right? So I was really curious about the VOMS. We teach this at USC, Chelsea and I. Maggie gets to learn it. Maybe someday she'll be teaching it too, because she's really awesome. But this is something that's newer. Like a few years ago when we were teaching this wasn't even part of it. So I thought maybe you could just dive in a little bit more exactly kind of like what it is and what it looks at for people.
Yeah, so the VOMS has 5 different components of the ocular motor screen that you look at, and then it has you rate the patient's symptom response as you're performing the test. So it's a great measure to test in the beginning when you do your initial eval, but then when you progress them and see how they're doing in PT, it helps you kind of assess and see if treatment is really working. And then what I found to be the most interesting, and this is why the VOMS is more preferred in terms of the screen, is that it includes convergence. So convergence is the ability of your eyes to adduct together. So like if you're looking at a point on your nose, and convergence is actually really specific and sensitive to identifying post-concussive syndrome and like prolonged recovery for concussion. So a positive examination can be correlated with that, which I thought was really interesting. And yeah, so that's the VOMS. That's like a general overview of the VOMS. It's like very quick, but
No, I think that's really helpful, and it's always nice to add in more objectivity to the screens that we do on a regular basis.
Yeah, and it's good to have that like standardized across people, because there's like a chart that you actually can find online, and you can write down in the chart so you can track it, and if other therapists are seeing them, they can also track the same measure.
Yeah. Yeah, that's awesome. And I know we've used the Buffalo protocol here as well, and it is really important for that progression part. So can you talk about that?
Yeah, so the Buffalo treadmill test or protocol is a test that's done on the treadmill, and it's increasing the percentage in grade. So it's actually the incline of the treadmill, and you're assessing the symptoms as you go along that. So we'll have someone, even with acute post-concussive syndrome or like just an acute injury, this is a safe test to perform and hasn't been correlated with increased symptoms that we can do to check and see when the symptoms come on, with what intensity and how hard you're working, as well as checking blood pressure. And this can aid in differentiating between different concussive symptoms and differentiating between like a cervicogenic injury and like just the etiology of the concussion. And that brings a good point too, because we didn't talk about this before, but another part of the assessment is really screening the neck, because you can have neck injury that can be detrimental as well. And so you want to make sure that the ligaments are intact and that you're being safe with that, and that the artery flow is okay and those type of things. So yeah, that's your concussion test.
And maybe this is why concussion is like so fascinating, is that it's this inner, you know, like neurology, orthopedic pieces that are combined that I find pretty fascinating. And I think headache is one of those. So I think we get a lot of questions from our clients about headaches and the meaning of it, and in particular with concussion or maybe post-concussive syndromes. Maybe you could tell us a little bit more about what that looks like.
Yeah, so headache is actually the #1 reported symptom post-concussion injury. And fun fact, there's like I've seen up to 86% of people will actually report headache as one of their symptoms, which is obviously a huge number of people. But the headaches will vary in terms of their presentation. So you might have like these tension headaches, you might have migraine type headaches, or even cluster headaches, and they can all present simultaneously within that in the individual, and they might have a cluster type headache one day and a migraine headache the next day. But those are all kind of common symptoms associated with concussion. Yeah, so it goes to show how integrated all those different systems are and how they're involved with concussion. And that's why it's important when you're doing your initial eval to screen, you know, the vestibular system, the visual system, the cervical spine, you know, and going through, and cognition, you know, just going through all those different screens, because it's so involved.
Yeah, that's great. So that is like the nutshell version, I think, of the approach. Certainly you could dive really into all of those systems, into the VOMs even more, but we wanted to give you that overview of really, so you could see how physical therapy can both get in there and really in a detailed way, assess, and then help people get back to full function. And that full function really comes through that thorough assessment, right? Because that's how you progress things. Like, you don't progress when those things don't settle back down or if they get worse, right?
Yeah.
So I think that's really awesome. And Maggie and Chelsea have really done an awesome job of putting together our program. We're so excited to really be working with more people, be joining forces with neurologists as well to help treat concussion. So thanks so much for joining us. If you want to learn a little bit more, find us on our website at www.reactivept.com, and you can sign up for our newsletter and get in touch with us. If you have more questions about concussion, email us as well. You can email us at info@reactivept.com, and we'll catch you next week.
Yay!